Hi everyone, my name is Keegan Buch, and I'm a post-bac researcher at the Prevention, Early Intervention, and Addictions Recovery Lab here at Keck. Today I'm going to be presenting on some research that I've been working on for the past number of months that I'm very excited and also a little nervous to be sharing with you all. So this is an examination of pre-gaming behavior and motives among sexual and gender minority college students. So I kind of wanted to start off by going over what pre-gaming is. Pre-gaming is a very popular but also high-risk activity common among college students, and it involves the consumption of alcohol prior to another social event in which more drinking usually occurs. According to a 2016 review by Zamboanga and Altuis, about 40% of college students report having pre-gamed in the past month. However, that statistic is actually a bit higher now. An updated review came out after I finished these slides that suggested that those rates are around 60 to 90% now. So it is very prevalent, and this is really important to consider, seeing that pre-gaming has been associated with several alcohol-related consequences, namely increased risk for blacking out, hospitalization, and sexual violence victimization. So although this is a very growing field of research, there is unfortunately no research into the pre-gaming behaviors of sexual and gender minority college students. And why is that so important? Well, sexual and gender minority college students, or SGM students, are a particularly vulnerable population when it comes to hazardous alcohol use. There isn't a whole lot of research out right now, but the few studies that do exist suggest that they may be at increased risk of experiencing negative alcohol-related outcomes compared to non-SGM students, even when they consume the same amount of alcohol. And these differences may be attributed to the minority stress theory, which posits that the additional minority stressors of being a sexual or gender minority, so for example, discrimination related to their identities or even internalized transphobia or homophobia, may be associated with more negative health outcomes, so which of course includes hazardous alcohol use and negative alcohol-related consequences. So with that theory in mind, I thought it was warranted to look at the alcohol use behaviors and alcohol-related activities such as pre-gaming among SGM students. So the present study had two primary aims, and we utilized baseline data from a completed randomized control trial that was looking at a mobile intervention for college students who pregame. So our first aim was to look at some mean level differences in pre-gaming behaviors and motives between SGM and non-SGM students. Pre-gaming behaviors being the number of drinks they consume during pre-gaming, as well as the consequences they experience as a result of pre-gaming. And then our second aim was to look at whether SGM status was associated with pre-gaming behaviors and whether it moderated the association between pre-gaming motives and pre-gaming behaviors. So we had our sample was 485 college students who reported pre-gaming at least once per week or 4 times per month. Our sample was, or we had 19% of our sample was a sexual or gender minority. So this includes anybody that reported that their sexuality was anything other than heterosexual and or that their gender was anything other than cisgender. And participants completed measures of past 30-day pre-gaming drink consumption as well as their consequences, and they also reported on their motivations for pre-gaming. So to accomplish our first aim that I mentioned previously, we did some mean comparisons between SGM and non-SGM students on their pre-gaming behaviors as well as on their motives. And then for the second aim, we ran 2 hierarchical regression models, one for total pre-gaming drinks and another for pre-gaming consequences. Before I jump into how we did that, I also want to talk a bit about the measures that we used. So we calculated participants' total pre-gaming drink consumption in the past month by multiplying their reported days of pre-gaming as well as their average drinks consumed during pre-gaming in the past 30 days. Participants reported their motives for pre-gaming by responding to the pre-partying motives inventory, which asked questions about 4 different potential motivations for pre-gaming. So namely interpersonal enhancement, situational control, intimate pursuit, and barriers to consumption. And I've included some examples of questions there to kind of clear up what exactly those motives are, if there's any confusion there. And then lastly, participants' consequences of pre-gaming were assessed via the brief young adult alcohol consequences questionnaire, which asks yes or no questions about whether participants experienced certain alcohol-related consequences and whether or not they experienced them on days that they pre-gamed. So for example, passing out while drinking, or passing out from drinking, or driving while intoxicated. So back into the hierarchical regression models that I mentioned. So our model for total pre-gaming drinks per month, we had 2 steps. In the first step, we looked at the effects of 3 different demographic characteristics, namely age, SGM status, and race on total pre-gaming drinks per month. And we also looked at the effects of the 4 pre-gaming motives on pre-gaming drinks per month. And then the second step, we looked at the 4 interaction effects of SGM status with each of the 4 motives on total pre-gaming drinks per month. And then we ran the same exact thing for pre-gaming consequences. So onto results, there were a few key findings from the study that I really wanted to highlight here. So first, we found that there were no differences between SGM and non-SGM students in any of the 4 pre-gaming motives, but we did find that SGM students reported significantly less pre-gaming drinks per month compared to non-SGM students, about 10 drinks less per month. And then we also found that there was no significant difference in the number of pre-gaming consequences they experienced in the past 30 days, past month. And then we found one significant interaction effect. We found that SGM status moderates the relationship between intimate pursuit motives and pre-gaming drink consumption. So essentially, among students who reported that they had high intimate pursuit motivations for pre-gaming, so for example, this is if they pre-gamed in order to increase likelihood of hooking up at the later event, among those who were non-SGM reported significantly more drinks than those who were SGM, but no other interaction effects were significant. So I think what we can gather from this is a really unique point of view into SGM students and their drinking behaviors. We found that, again, even though SGM students drank significantly less during pre-gaming than did non-SGM students, they experienced a very similar number of pre-gaming consequences, which is kind of in line with past research that has suggested that SGM students may be at increased risk for experiencing alcohol-related consequences. We also did kind of interestingly find that being SGM may be protective against pre-gaming drink consumption under certain circumstances, namely when one reports high intimate pursuit motivations for pre-gaming. But these are, of course, very early findings, and future research needs to look into this a bit more and, of course, continue expanding research on pre-gaming among SGM students. I will say that this study was unfortunately limited by the fact that our SGM sample was largely made up of cisgender bisexual women, and unfortunately didn't have any transgender or binary transgender individuals, so we didn't have any transgender men or transgender women. So future research in this area should absolutely aim to include more subpopulations of the SGM community, because it is a very broad population, and it is possible that if we had a wider range of SGM students in this sample, the results might have been a little different. And then lastly, we suggest that future research look into pre-gaming motives that may be specific to SGM students. The pre-partying motives inventory that we used in this study was developed without gathering SGM status information from participants, so it is possible that it wasn't able to reveal potential differences in motivations for these groups. But I think overall this is really important stuff. As far as I know, there's no research into this at all, so hopefully this kind of lays a good foundation for future research into SGM pre-gaming. But yeah, I also wanted to thank the study team, especially my mentor, Dr. Peterson, and I also wanted to thank IS for giving me the opportunity to present this work. Here are my references, and I'm open to any questions or comments. Thank you.
Any questions?
Hi. Oh, sorry. Great presentation. Thank you very much. I'm curious, do you think that there's any kind of self-reporting bias that may play into people's willingness to correctly self-report how many pre-game drinks they may be having? And if this self-reporting bias maybe even has an even greater effect on the SGM individuals?
Yeah, totally. Yeah, definitely didn't look into that too much, but it's obviously, probably a huge thing with anything that's self-reported. So it's definitely possible. Past research into SGM, drinking in general, has been kind of mixed as well, so it's kind of hard to know whether that can kind of help us give or understand these results as well. Past research has found that either SGM students drink as much or a little bit more. Some research has found that they drink significantly less in general, so it's kind of hard to tell whether there's anything going on there in terms of whether they're not reporting correctly or anything like that, but hopefully that answers your question.
Really nice presentation, thank you. I'm wondering, did you consider looking at gender differences among the non-SGM group to see whether there were differences among male, masculine, and female, feminine?
Right. I'm going to be totally honest, I don't totally remember if we ran those, but I can definitely get back to you on that. Yeah, I can't totally remember. We had like a little bit of a non-binary sample there as well, so I'm not sure if
Yeah.
we looked into that. But
It might be interesting because there's probably, there may be differences in drinking habits.
totally, yeah, I can definitely get back to you on that, like via email if you want.
Nice job.
Thank you.
Thank you, Keegan.
Thank you.
Great job. Next up, we have Siddhi Ganesh.